My name is Dr. Radhika Banka and I'm a consultant respiratory physician at PD Hinduja Hospital, Mumbai. So as they say, safety is a small investment for a rich future. And we know that it's of paramount importance to involve patients and their relatives to ensure patient care. So why is it so important to involve patients and their relatives for patient care? So have you ever thought, it's only when the patients and their relatives are informed, are engaged in their care, is that we are able to make a correct diagnosis, we are able to identify symptoms which probably would have been otherwise missed. We can identify the unmet needs of the patients. So their involvement also helps us to decide the nature of the treatment we provide them. It integrates into the psychological aspect of the illness, which is very important for patients. It takes into account the needs and the desires of the patient and their relatives, and this overall provides a much more wholesome treatment to the patient than what would we have provided without the support of the patient and his family. Now, what is also more important is that just having the patient and their relatives being involved in the patient care leads to better treatment adherence, leads to better compliance of treatment, because the patients are much more aware of their illness, they're much more aware of the treatment they're getting, so they're more vigilant in terms of picking up any errors, they're more vigilant in picking up side effects which would have perhaps been otherwise missed or picked up at a much later stage. So the patient and the relative being informed or being involved in the care of the patient, it also to a certain extent enhances the patient-doctor relationship. It puts an amount of trust into the relationship so that the patient can really trust the doctor, because they feel that the doctor has kind of empowered them also to take decisions for their health, putting their wishes, putting their needs, putting their thoughts also into the treatment. And this kind of personalizes treatment, because as we all know, medicine is not one fit all. So every patient is different, every treatment would be different, and just involving the patient and the relatives provides a much more wholesome experience to the patient and the family, and it of course improves the overall quality of life. And now there's enough data published to which tells us the same.